Hello everyone, now let us discuss about 2023 CPT coding guidelines for surgery, eye and ocular adnexa. In the part 1, we will be discussing about the CPTs in the range 65091 to 65290. Now first of all, coming to the first topic, that is eyeball. Eyeball is again categorized into following ranges: removal of eye, secondary implant procedures, removal of foreign body and repair of laceration. The CPT range for removal of eye is 65091 to 65114, and for secondary implants procedures the CPTs are in the range 65125 to 65175. And for removal of foreign body, they are in the range 65205 to 65265. And finally, repair of laceration, it comes under the range 65270 to 65290. Now, first of all, coming to removal of eye, the first CPT is 65091. It is nothing but evisceration of ocular contents without implant. Evisceration is nothing but it is a surgical technique by which all intraocular contents are removed while preserving the remaining scleral shell, extraocular muscle attachment and surrounding orbital adnexa. That is evisceration. Evisceration of ocular contents without implants. And whenever evisceration of ocular contents with implants is performed, the CPT is 65093. The next is 65101, that is enucleation of eye. Enucleation is nothing but removal of entire eyeball, leaving behind the lining of the eyelids and muscles of the eye. So enucleation of the eye without implant is given by 65101, and enucleation of the eye with implant, muscles not attached to the implant, that is given by 65103. And if the muscles are attached to the implant, it is given by the CPT 65105. And for conjunctivoplasty after enucleation, you need to see 68320 sequence. Now coming to next CPT, that is 65110. It deals with exenteration of orbit and does not include the skin graft. Removal of orbit contents only. Exenteration is nothing but removal of globe and all of the orbital contents. The next is 65112, exenteration of orbit with therapeutic removal of bone. The next is 65114, exenteration of orbit with muscle or myocutaneous flap. And for skin graft to orbit, you need to refer 15120 and 121, and for free full thickness, you need to refer 15260 and 261. And for eyelid repair involving more than skin, we need to refer the CPT sequence 67930. Now coming to the next CPT, that is secondary implant procedures. There are two implants, ocular implant and orbital implant. An ocular implant is an implant inside the muscular cone, whereas an orbital implant is an implant outside the muscular cone. So the first CPT is 65125, modification of ocular implant with placement or replacement of pegs. For example, drilling receptacle for prosthesis appendage. The next is 65130, insertion of ocular implant secondary after evisceration in scleral shell. The next is 65135, insertion of ocular implant secondary after enucleation, muscles not attached to implant. The next is 65140, insertion of ocular implant secondary after enucleation, muscles attached to the implant. The next is 65150, reinsertion of ocular implant with or without conjunctival graft. The next is 65155, reinsertion of ocular implant with use of foreign material for reinforcement and for attachment of muscles to the implant. For the reinforcement and or attachment of muscles to implant. The next is 65175. It deals with removal of ocular implant. And for orbital implant outside the muscle cone insertion, you need to refer 67550. And for its removal, the CPT is 67560. Now coming to the next topic, that is removal of foreign body eyeball. Before going into eyeball CPTs, here are certain other CPTs that must be referred for particular segment. And for removal of implanted material, ocular implant, you need to use 65175. And for anterior segment implant, removal of anterior segment implant, the CPT is 65920. And removal of posterior segment implant, the CPT is 67120. Removal of orbital implant, the CPT is 67560. And for diagnostic X-ray for foreign body, the CPT is 70030. And diagnostic echography for foreign body, the CPT is 76529. And for removal of foreign body from orbit, frontal approach, the CPT is 67413. Lateral approach, it is 67430. And for removal of foreign body from eyelid embedded, the CPT is 67938. And for removal of foreign body from lacrimal system, the CPT is 68530. Now coming to the first CPT, that is 65205. Removal of foreign body, external eye, conjunctival, superficial. And the next CPT is 65210. Removal of foreign body, conjunctival embedded. It includes the concretions, subconjunctival or scleral non-perforate. The next is 65220. Removal of foreign body, corneal without slit lamp. The next is 65222. Removal of foreign body, external eye, corneal with slit lamp. And for repair of corneal laceration with foreign body, you need to use the CPT 65275. The next CPT is 65235. Removal of foreign body intraocular from anterior chamber of the eye or lens. And for removal of implanted material from anterior segment, you need to see 65920. The next CPT is 65260. Removal of foreign body intraocular from posterior segment, magnetic extraction, anterior or posterior route. The next is 65265. Removal of foreign body intraocular from posterior segment, non-magnetic extraction. And for removal of implanted material from posterior segment, you need to see 67120. The next topic is repair of laceration. Before going into CPTs of eyeball, here are the list of other CPTs. For the fracture of orbit, you need to see 21385 sequence. And for repair of wound of eyelid, skin, linear, simple, you need to refer the codes 12011 and 12018. Intermediate layered closure, you need to refer 120512, 12057. And for linear complex, you need to refer 131512, 13160. And for others, you need to refer 67930 and 7935. And for repair of wound of lacrimal system, you need to use 68700. And for repair of operative wound, you need to use 66250. Now coming to the first CPT of repair of laceration, that is 65270. Repair of laceration, conjunctiva with or without non-perforating laceration, sclera, direct closure. The next is 65272. Repair of laceration, conjunctiva by mobilization and rearrangement without hospitalization. And if hospitalization is seen, that is 65237. Conjunctiva, repair of laceration, conjunctiva by mobilization and rearrangement with hospitalization. The next is 65275. Repair of laceration, cornea, non-perforating with or without removal of foreign body. The next is 65280. Repair of laceration, cornea and or sclera, perforating. Previously it is non-perforating. Now perforating, not involving uveal tissue. The next CPT is 65285. Repair of laceration, corneal and or sclera, perforating with reposition or resection of uveal tissue. One important point is 65280 and 285 are not to be used for the repair of surgical wound. The next CPT is 65286. Repair of laceration by application of tissue glue, wounds of cornea and or sclera. And the repair of laceration includes the use of conjunctival flap and restoration of anterior chamber by air or saline injection when indicated. And for repair of iris or ciliary body, you need to use 66680. The final CPT is 65290, which deals with repair of wound, extraocular muscle, tendon or Tenon's capsules. Now let us see an example. A patient presents to the emergency room with a severely damaged eye. The injury was sustained when the patient was a passenger in a multi-car accident on a public highway. And the patient sustained a large open lacerated wound to the left eye. See the laterality, left eye. Large open lacerated wound. The posterior chamber was ruptured and significant vitreous and some intraocular tissue was lost. The eyeball was not repairable. The eyeball was not repairable, so was removed. So here removal of eyeball procedure has been performed. A permanent implant was inserted but not attached to the extraocular muscle. The patient was released with an occlusive eye patch. So here removal of eyeball along with the implant and muscles are not attached to the implant. Here you can see permanent implant was inserted but not attached to the extraocular muscles. So the correct CPT is 65130, which deals with enucleation of eye with implant, muscles not attached to the implant. Enucleation is nothing but complete removal of the eyeball, as we have discussed in the session. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.